That's a nice quote from Armin Yalnizyan. The growing gap is another inconvenient truth of our era, every bit as threatening to our health, our economy, our future as climate change. In terms of poverty in this province, this is a quick snapshot of where we are at according to the 2006 census. The low income rate varies quite significantly across the province. In 2006, we had 13.8% of people in Nova Scotia living in low income, and that's persons living in low income before tax. That was down about 5% since 1996, so 5% in 10 years. The highest rate in the province, according to the census, was in Yarmouth, 27%. And that is, if you look at Halifax, at 14.3, that's double the rate that it is in Halifax. The second highest was in Amherst at 19.4, and then Cape Breton Regional Municipality had the third highest. Antigonish County has the lowest at 7% in Subdivision A and 9.4% in Subdivision B. And then if we look at something else that gives us a sense of where poverty is in the province, the poverty gap, which is there. The cornerstone of income support in this province is our employment supports and income assistance, or our welfare program, our income assistance program. It is absolutely inadequate when we even just look at where people are at in terms of the poverty line. So the gap between what people get on income assistance and what we would consider in terms of the LICO after tax is quite striking. You can see that lone parents have made some advancements, and I didn't give you where we've come from, but that's mostly because of the child tax benefit. But if you look at single employable, and we know those have been, and we'll hear more from Stella about why that group has been the target of some of the shifts and reforms in our ES&IA program, they're looking at 41% of income. So they'd need quite a bit in order to just reach the poverty line. So absolutely inadequate in terms of just paying for necessities. The other group that we need to be thinking about when we look at poverty and think about the approach that's been taken is the near poor. And there are many ways of thinking about who that is. Stats Canada looks at those who earn up to 25% above the low income cutoff. And when they looked at that in 2006, they found 1 in 6 Canadians are near poor. The other ways that we can look at that is to look at those who are spending more than 30% of their income on housing, because that's certainly a risk in terms of homelessness. That means that you're in core housing need, you can't find affordable housing, you can't find suitable housing, you can't find adequate housing, and you're spending far too much of your income on housing. And then we can look at other indicators in terms of the rural areas. We know there are more homeowners in rural Nova Scotia, but we also know that those homes need major repair. So that's something that we have to be concerned about, because it means that there are long waiting lists for grants for repairs, and that can be a significant cost for people in those homes. So they may own their homes, but we're looking at a very precarious and vulnerable members of our population, and that can be quite a large number. And then the last thing that I think we need to be thinking about and looking at in this province, obviously, is those workers who are working at very low wages. So 22% of our workforce earn $9.99 per hour or less. So if we look at our minimum wage is going up again next year, it'll be around $9.60, I think it's going to go up to. That's still not a living wage in this province. That's still quite low. That means that while there was a time that perhaps getting a full-time job would mean you can get out of poverty. If you're working at minimum wage and even up to $10 an hour in this province full-time, full year, you're not out of poverty. I'm going to go fairly quickly through some of my notes around the different populations, but I think it is striking, and it is something that we have to take into consideration as we think about whether our public policy is actually responding to needs in this province. Whose needs are really being responded to, and who is consistently excluded from the economic prosperity that we saw unprecedented before the last recession. And we should keep that in mind as well. We haven't been in this recession very long, but that will exacerbate the divisions and disparities we had in this province at a time when we had an opportunity to do something about it. So this, most of these stats are drawn from a regional health survey that was done with partners at the Mi'kmaq Health Research Group at Dalhousie and partners in the Mi'kmaq First Nations. And the numbers are quite striking, and you know, obviously they tell us a story about what's happening, not just in terms of First Nations who are living on reserve, but others. So if we look at the homelessness report card and think about the fact that only about 1% of the Halifax regional municipality is Aboriginal, but we're seeing about 10 to 12% homeless. That's a huge disproportionate number. And we're seeing, we are seeing in this province some shift from rural Nova Scotia into urban Nova Scotia in terms of the First Nations population. We see higher rates of Aboriginal in rural Nova Scotia than in urban Nova Scotia, and that's not the case in most other provinces. But obviously we are seeing the homeless population growing. So these are concerns. African Nova Scotian, a very similar picture in terms of homelessness and HRM, in terms of living in low income. It is even more, well, it's probably equally as difficult to get data on both of these groups, especially Aboriginals living on reserve or off reserve, but especially for African Nova Scotians. You know, we often don't have disaggregated data that tells us what's happening in this community. If we do, it's lumped in with visible minorities, or we have to look at some Canadian data that talks about African Canadians. Huge disparities. And we know that this is, you know, these are having implications in terms of health status. We know, for example, in terms of African Nova Scotians, that they experience higher rates of heart disease, higher rates of cancer, high blood pressure, diabetes. And so the disparity, we are seeing the implications and have seen them for a long time. The implications of what's happening with these populations in terms of disparities. We will be hearing, of course, about the resilience that exists in both these population groups. And some of the positive things that have come about, like the Mi'kmaq Rights Initiative and the negotiations that are happening, the tripartite, or well, not just tripartite, but bringing all the people finally at the table to have some serious discussions about rights in that community. And I think the same is true for the African Nova Scotian community somewhat, although I think we'll hear a little bit about where we're at in terms of Africville. And the other group is women. We are still seeing more women living in low income than men. The gap is higher still for senior women, age 65 and older, than senior men. And for single mothers, it's still strikingly high. So while we've made some improvements there, we have a long way to go. So we need to really be thinking about gender and vulnerability. And the other group is people with disabilities. We have the highest percentage of people with disabilities in our population in Nova Scotia, and they continually are not being included in economic prosperity. Only 52.6% participate in the labor force compared to 79.1%. And we know from those groups and from what we hear from those communities that that's not because they don't want to work. Really, that quote that I pulled there from a document from the Nova Scotia Advisory Council on the Status of Women: discrete but interconnected systemic and attitudinal barriers that remain entrenched to delay, discourage, or prevent those with disabilities from participating in the labor market to their full potential. You could substitute their people with disabilities with African Nova Scotians, with Aboriginal people, and still with women in our province. There's not just a disability wall. We're talking about systemic discrimination, and that is a key part of this picture that we need to be thinking about how to address.